First of all, I'd like to thank you for inviting myself and Denise to speak to you. Today what we'd like to do is we'd like to look at the historical perspective of mental health and learning disability, reflecting back to be able to look forward. We're going to do this in that we're going to look at the meaning of mental health and then the meaning of learning disability. We're going to look at some theory, and then we're going to do a live performance of one person's story presented at two different times in history. And then we're going to look at some evidence-based practice and individualised care to bring the presentation together.
So why look at mental health and learning disability? Well, people with mental health issues or a learning disability are among the most socially excluded and vulnerable and disadvantaged groups in Britain today. So what do we mean by mental health? Well, the World Health Organization says it's a state of well-being in which every individual realises his or her potential, can cope with normal stresses of life, and can work productively and fruitfully, and is able to make a contribution to his or her community. So it's a well-being model.
With regards to learning disability, there is some controversy with the actual title. Sometimes we see it as intellectual disability, and frighteningly, the World Health Organization actually refers to these individuals as having mental retardation. So obviously we have to be mindful that the ones that we're going to use today is learning disability. And this is led by the Department of Health, looking at the papers from Valuing People and also the NICE guidelines. So what do we mean by this? Well, we mean that this individual has a significant reduced ability to understand new and complex information, and that they have a reduced ability to cope independently in the community. And as such, it's really important that we recognise there are great severities between individuals who have a learning disability.
So, the historical perspective of mental health and learning disability. Before the end of the 18th century, generally there was a culture of acceptance and tolerance, because most people at that time, people were educated and stuff, so it was about what people could do. So in the pre-industrial revolution, the issue of difference in society didn't exist as we know it, as survival depended on everyone working together for the good of all. The migration to the cities identified individuals who lacked skills and made them stand out more, because previously they might have been working more with the family. So anyone different, vulnerable or slow would be seen as feeble-minded or an imbecile. The poor laws and parishes would fund and provide the workhouse to hold these individuals, and it was the idea of the deserving and the undeserving poor, who were often who were often sent to asylums along with criminals.
And part of this time was that we then gained a philosophy. So the eugenic philosophy led to Mental Health Deficiency Act. This act in itself actually restricted individuals and their rights. This moved on with the reformists trying to change things, and we have the Second World War and then the National Health Service. Individuals with a learning disability obviously did not flourish in this environment, and it wasn't until Tizard and other philosophers came about to look at the alternative. And we now have the Tizard Centre down in London looking at sort of like the best ways to move people and support people with learning disabilities. In terms of mental health, medication was more effective, and so controlling patients was more acceptable, and these individuals then were able to move more into the community. The anti-psychiatry philosophy was also gaining momentum, and questions were sought around whether the asylums were in fact places for these individuals.
So, with the closure of the mental health hospitals, they were called psychiatric hospitals at that time, in the 1970s and 80s, individuals with mental health or learning disability were starting to be integrated back into society. So this was the main push of getting people back into society and the closure of some of these hospitals. And looking at more choice for these groups were created as more legislation came in, such as the Human Rights Act and the Equality Act, Mental Capacity Act.
So now what we'd like to share with you is a live performance of one person's story presented at different times in history. Oh, I'll change that one. Hello, my name is Mary Smith and I was born in 1860.
Hello, my name is Mary Smith and I was born in 1960.
When I was a child, we grew up in the farm, and although I didn't really understand what people were asking me, and I couldn't add up, and I found things very, very difficult, I was able to do chores. For example, I like to put the hay together in a really logical way, and I would wrap it very carefully. Most of my friends, they weren't bothered to do this, but for me, I felt like there was a point to it, to my life. We were fed quite well, and we were very, very happy. Unfortunately, work became very hard to get.
I have a lovely family. I have a twin brother and lovely parents, but I went to school and from day one I hated it. I found it really difficult to make friends and to learn, so I'd sit at the back of the class and I'd be called names and I'd be bullied. Meantime, my brother was doing really, really well and doing well at school, and he continued to do so.
At the time, the Education Act in 1870 hadn't come out, so I didn't have any schooling. But I wasn't really bothered because I really struggled with things like counting anyway. Because my family couldn't get jobs in the farm, we had to go to the city. I felt it was really, really damp and smelly, and we lived in one room and it was really awful, and I hated it. My mother at the time, she knew that I had to work, so she tried to put me in service as a scullery maid, but they shouted at me and I didn't really understand what they were asking of me, and I got very distressed. They told my mother that I was an imbecile, stupid, a useless girl. This really upset me, so she tried to send me to the factories, but it was noisy and I didn't understand what was going on, and at this time it felt all very confusing. So she decided that she would marry me off. I was 14 years old at the time. This man came and he told my mother he wanted to see what he was getting, so he touched me and I didn't like it, and I scratched his face. I didn't know what I'd done. But the next thing was the constable came and arrested me, and I was in front of the magistrate. At school, things just got worse. I wasn't popular, I didn't really have any friends, I tried to fit in. I started fighting with some of the other girls, and drinking and smoking and swearing at the teachers and everything. I just didn't like it, and I just distanced myself more from them, and I was expelled at the age of 15. I was in front of the magistrate, and the magistrate, he told my mother that if she could afford to pay the fine, that was okay, I could go home with my mum. Of course my mother didn't have the money, and I landed up in Bridewell in Liverpool. I couldn't believe it. What had I done wrong? I didn't mean to do this thing. What was going to happen to me? I tried to keep myself to myself, and as time went by and I was trying to sort of isolate myself, I started hearing voices and I saw angels, and they were telling me, just keep yourself together, just stay by yourself, you'll be all right. And this is what I did. But the prisoners misunderstood what I was trying to do, and they thought that I was better than them. One night, the warden came in And he said, I'll show you what it means to be married. And he touched me, he prodded me, and he poked me. He threatened that he would kill me, and I just kept quiet. I cried and cried, and I couldn't use the language to try and tell anybody what was happening.
I wasn't going to school now, so I'd sit at home, watch TV a lot of the time, get shouted at for not helping with the housework or anything, not bothering as much with my family, and I started having messages from the telly. Aliens were starting to communicate with me, and I just couldn't make sense of it all. And the aliens were communicating with me as well through voices.
I did my prison sentence, and I started crying so much that people didn't even talk to me. I was in the corner, and I started rocking. They took this to the magistrate, and instead of the magistrate let me go home, he said, you won't be a burden on your mother anymore, girl. And he sent me to the workhouse. At first I was very frightened. I just wanted to go home to my mum. But then I realised that in the workhouse there was segregation. I didn't have to come across men, so I felt safe. The cook was actually quite nice. Because I was too old at this time, I was about 14. I was unable to go to school, so they sent me to the kitchens. And the cook was very, very nice to me. She actually gave me extra food. I was just so happy. And she said, oh, by go, girls. I'm really pleased because you're really getting fat now. I'm feeding you up. Before you came, you were very thin. Unfortunately, one night, I had so much pain, I couldn't believe it. And then all of a sudden, a baby was there. How did that happen? I hadn't done anything. What was going on? After that, the cook was very mean to me. She called me a fallen girl and a whore and a no good girl. I still didn't understand what was going on, but I wanted my baby. I was screaming for her, but they said that she died, and they just told me to shut up.
When I was 16, I had to go to work. So I was put on one of these government schemes called a youth training scheme, and I was sent to work in a factory. I didn't know what to do, or still difficult, couldn't really make any friends. Some of the older women were really nice to me, but it was just too loud. I couldn't stand the noise. I couldn't stand it, so I had to get out. I'd just take myself off and go outside. So I'd get into trouble and I'd get sacked. And then I'd get a job in another factory and the same thing would happen again. It just wasn't working for me, this factory thing.
I was so distressed, and I kept hearing these voices, and these voices kept saying, they're against you. Watch out, they're against you. And I just felt really, really frightened and upset. I couldn't talk any longer, and I sat in the corner. And I was just rocking. They didn't know what to do with me, so they committed me to the asylum. How did I deserve that? I didn't deserve that. What have I done? One day, one of the wardens came up to me, and I was frightened that he would do the same thing that the prison officer had done in the prison. So I scratched him and hit him, and bit him hard. But the voices had told me to do that. I didn't want to do it. He hit me, and I fell so hard and hit my head. I was unconscious. When I woke up, they'd removed all my teeth, and they'd said to me, there you go, girl, you can't bite anyone now, can you? They tried all sorts of different methods. They would have beating rods to hurt me, trying to get the devil or the evilness out of me. And I didn't understand. I wasn't bad. I didn't really know what was going on. But finally, they used to use water. If we were lucky, they would warn us and we could take our clothes off. But sometimes they didn't even care, and they would put the water all over us. And as a consequence, we would be in our cold clothes and our wet clothes for about 2 or 3 days. One winter, I got a really bad chill and I got pneumonia. I died in pain and agony I was 25 years old.
I was by now in my early 20s. The voices had never gone away, but I was spending more and more time by myself, not really communicating with my family, not coming out of the bedroom. And then one day it all got too much, and I smashed the television with a hammer. The police came, parents got the police. I ended up in this hospital, and they said I was on something called a section. Oh, it was terrifying. It was great big corridors, patients walking around like zombies. They put me on some medicine. It was really, really strong, and they were giving me injections. My legs were trembling. I just felt as if I was some kind of a zombie. And I really was terrified. Eventually, I got a job in what they called industrial therapy, and I got £10 a week. And what I was doing was I was putting little gift tags in bags. That was all right. Quite nice there, not too bad. But the only place to go and spend the money was to go and get it out of the bank in the corridor and go to the shop. That was absolutely terrifying. Some of the patients were asking me to get them cigarettes all the time. Can I have a ciggy? Can I have a ciggy? Get me some cigarettes. And some of them wanted me to be their girlfriend. I wasn't interested. I was absolutely scared, so I'd spend as much time on the ward as I could. I felt more safe there. Eventually, I had a chance to start going into this house in the grounds, and they called it rehabilitation. And I was taught how to cook and how to clean, and, things weren't too bad. But today, a lot of years have passed by, the hospital closed down, I did get back discharged to my family, but then eventually I got my own flat. A few years ago, in the late 90s, I came off my injections and had a tablet instead, and the side effects are a lot less. Still hear the voices, but I've learned how to cope with them better. I got a diagnosis at that time as well, while I was in the big hospital at the time as well. They said I had schizophrenia. But anyway, I've been on different courses over the years, assertiveness and different things. And now I work in a charity shop. I help out, I'm a volunteer in a charity shop. That was terrifying because I'm really shy and I didn't want to work with the public. So they said that I didn't have to. I could stay behind the scenes if I wanted to. I could price things up. But, the customers are nice. We get some of the same customers coming in all the time. And now they think that I might be autistic. We still don't get it right, though. Despite everything, we don't get it right. We've still got outdated mental health legislation rooted in the middle of the 20th century, still using the same legislation, the basis of it, when I first went to hospital in the 1980s. When the person went. Denise, do you want to
So where are we today? Well, from all the evidence-based practice and from our practice as nurses, we believe that we need to follow the social model of disability and the person-centred planning for individuals, whether they have a learning disability or whether they have a mental health or both. And the main thing, I think, and from the evidence, is that we need to make sure that these individuals are empowered, and we do that by giving them a voice.
Individuals with learning disability or mental health problems need support to feel empowered. And I know the word empowerment can be a cliche, can't it, and almost seem a token. But nowadays it's expected that people will be involved in services that they're going to use, that they'll be involved in the setting up of those services. And we've got buzz things going on like co-creation, co-production, and initiatives and services to support people to live better. Legislation has compelled us to have a more rights-based and ethics-based approach to care.
So, to protect the rights of these vulnerable individuals, it's important that we follow the social disability model in the community to empower and enable individuals who live with a mental health and or a learning disability and to have their voice heard. And this is what we would like to see. Individuals in our community living among us, having lives together, working together and sharing together. Thank you very much.